Now, you mentioned when you were talking about the clinic being in the same building as health services and education, you mentioned tobacco use. And I'm assuming, do you have a big program for smoking cessation? And
we do, in the sense that, first of all, there's Smoke Free Arizona, which is basically educating the public businesses and stuff about the Arizona laws on Smoke Free Arizona. We have there's what's called the ASH line, where again, if the doctor sees somebody that is smoking and maybe expresses an interest in losing that habit, we can refer them to the ASH line. And again, it's just a sort of revolving process where the doctors are seeing the patients and the patients are being referred to different departments in education, and we just sort of do everything we can to provide services to.
You provide classes where
Yes.
people can go also on a regular.
Yeah.
Okay, great.
Yeah, we do both in-school programs
We do.
and
Okay.
community-related programs
Okay.
for smoking cessation.
Is that part of your job to go into the schools and
No,
talk about smoking cessation?
That's actually part of the health education
Health
department.
education,
Yeah,
okay.
I actually get to go on a little ride along with them this week actually and see how that works. But no, that's part of health education.
Okay,
Yeah.
great. You have a major category here in terms of food services and immunizations and basically community programs.
Yeah, we're calling it sort of safety and support, and in that is Food Plus. Again, based on your income levels and your location, you've got to live within Yavapai County. If you are underneath the federal poverty level, and for instance, it's about $1,100 for a single person, we will provide you once a month with a box of food, and it includes cheese and noodles and canned meat and stuff like that. Just basically what we're doing is we're helping those, and typically it's men, unfortunately, that are living on their own, possibly unemployed, and it's just basically a box of food. We distribute over 1,000 boxes every month through local locations within the
You have
county.
multiple locations where people can
Yeah,
pick it
all
up?
all throughout Prescott Valley, Cottonwood, that area.
Okay.
So that's Food Plus. We do adult immunizations. Everybody talks about childhood immunizations as we go back to school, and we've got several free clinics offering those free immunizations. But what nobody talks about is adult immunizations.
Sure.
There's a term that we're using called cocooning, where basically whooping cough or pertussis is quite often spread through adults. And so what we do is we try to surround the child or the children with adults that have been vaccinated for pertussis or whooping cough. And so there's that. There's travel immunizations if you're leaving the country. We have registered nurses that will tell you what immunizations you need for that specific location, depending on the season, what particular outbreaks are going on. So there's
Okay.
adult travel immunizations.
Sure. Okay.
As we also have prescription discounts. I actually brought one of our prescription discount cards. This is one of our prescription discount cards that allows anybody discounts on commonly prescribed prescriptions.
Really?
Most of the local locations, Walmart, Walgreens, those kind of places, take this card. They're more than happy to give it out, and you can find this quite a few places. The libraries have them, town halls, that kind of place. Or again, you can call me, and I'll get one out to you.
Great. Part of this testing, does that include HIV testing and other transmittable diseases?
Yes, HIV. We give testing for hepatitis A and B. That's another immunization that we recommend. Pneumonia for people 65 and older is something we recommend. And the big one, the real big change right now is shingles. It used to be if you were 60 years old or greater, they were recommending shingles, and now they've moved it down to 50. So basically, if you've had chickenpox as a child, there's a possibility that you'll end up with shingles, which is sort of like adult chickenpox. It's incredibly painful, discomforting, and can be scarring in cases.
Right.
So we're really recommending that if you're 50 years old and you had chickenpox as a kid, that you get a shingles shot.
Well, that can be extremely expensive. I mean, if you go to the drugstores or some of the grocery store drug stores, you're talking $200 and some.
Yeah.
Does the county charge that much for those?
No. The county, because we again want to do the best we can as for a service provider for this area, it's going to be based on your income. And if you are below the poverty level, the federal mandated poverty level, then your price goes down dramatically. It's
Okay.
really inexpensive.
Okay, good. Well, let's cover some of the other items on your list here. You have primary care. Well, we already covered the clinics, right?
Mm-hmm.
Okay. Medical reserves. Is that some of the senior involvement we talked about?
Yeah, again,
Okay.
it's these 900 plus people that live within the county that have some time, and you don't necessarily have to have medical skills. We're looking for anybody that's got some time and a willingness and a desire to help out in the community. It's not like the military reserves where you've got to give a weekend every month of your time.
Right.
We basically just ask that you go through some very general training. It doesn't take that long, and then you make yourself available so that when these incidences occur, we have people to staff the phones and, like I said, help with traffic control or communication, distribution, that kind of stuff. And it's an amazingly important part of the county. We really need volunteers.
I'll bet. Now, you mentioned one time, I think last week, we talked a little bit about the emergency preparedness. Can you cover that a little bit?
Yeah, and actually I'll give you the number right now. It's 928-771-3321. That's 928-771-3321. That is the Yavapai County Emergency Management number. And that would be the number that you would call if you need to be on that special needs shelter registry.
Okay, tell us a little bit about what that means.
Well, basically, let's say there is an emergency of some sort where a flood, which is one of the concerns in this area. Fire, flood are big issues in this area, where we need to evacuate all of Cottonwood or a large portion of Cottonwood. If you are on this special needs registry, this list then goes out to the police and the fire department, and then they can actually go to these locations, help you out of your home, make sure you've got oxygen, transport you to our special needs shelter if we have to set one up, if it's big enough. In the case where we had to evacuate Cottonwood, that would be big enough. Or if it's just a small location like a neighborhood, we would probably just then at that point send you to the hospital, who could handle quite a few. But that is the special needs list, and the medical reserves are people that might handle communication in that sense.
Now, this is a list that you try to keep updated. It's not something that people have to call when they hear a fire's coming.
No. Once you call, we will send you a little form that you fill out, you send back to us, and you're on the list. Now, we do ask that if you leave the area that you let us know,
Sure.
Just so that we're not knocking on doors of people who aren't
That
there.
would be a terrible list to maintain and keep updated.
It's a pretty good sized list, but it's important. So.
Okay. We're running out of time pretty quick, David. Is there something that we haven't covered that you think is important that you want to emphasize?
Just basically that this was just a sampling of some of the services that Yavapai County offers, and I really tried to orient this towards the senior community. We have classes just for children, as far as safe dating practices. Cottonwood's got a walk to school program that they're implementing. YavaPaiHealth.com is our website, YavaPaiHealth.com, where you can go and see a pretty complete list of our services. We're actually in the process of revamping our website as well to kind of modern and update the information. The people that have been updating it have just been doing a wonderful job. It's in need of a shakedown at this point.
Sure.
But YavaPaiHealth.com is a good resource. Go there and just check out some of the services that we offer.
Sounds great. Now, you mentioned a phone number.
Yeah.
Is this the main number that you're going to give us?
Well, there's clinic numbers if you want to set up an appointment to see a doctor or one of our providers, or just to see if you're qualified. And in Prescott or Prescott Valley, that's 928-583-1000. And in the Verde Valley, that's 928-639-8132. And then the medical reserves number, if you'd like to be a volunteer, that's 928-634-6895, 928-634-6895. And one last time, the county emergency management, which is 928-771-3321.
Okay, great. Now, as the front man, I assume you're available for talks just about any place.
Absolutely.
And if somebody's listening and they want to talk to you about providing or making presentations, they can call you
Yep.
at the county number.
928-442-5509. That's my direct number,
Oh,
and I'd be
okay.
more than happy to do just this and get the word out.
Okay, that's great. Well, you have a lot to offer, that's for sure. Are you, as an aside to all this, are you experiencing difficulties in the financial side? Are there cutbacks coming in today's economy that are affecting the health services provided by the county?
There are, and it's really unfortunate. Really, where we're seeing some financial cutbacks is in what we call WIC, which is Women, Infant, and Children. And so it's kind of a sad situation, but some of our services that we provide to mothers of newborn children and even preborn, those services are being cut. We're losing staffing. And so that's one of the things that I'm really trying to do is get the word out there that we have these services so that we can go back to our grant providers and show them that there really is a need, and that our numbers can go up with, and then hopefully our funding will follow. WIC is one that really has been hit hard, but generally we're in kind of a turbulent time. We don't really know where healthcare is going in the next couple of years. We know we'll still be around. We know we'll be offering these services. What they'll look like in 2014, we'll have to wait and see.
Well, it could be that you have